Hi, everyone. I'm Amy Oliver. I'm excited to be here working with OPA to provide you guys with this webinar on an introduction to psychological health and safety, and also the next one on psychosocial factors in pharmacy practice. I'm really looking forward to having you guys go through this content. It's so important in pharmacy practice right now that we're thinking about this. The profession is going through a lot of changes and a lot of difficult times. And so more than ever, this is such an important topic. I hope you enjoy the rest of the presentation.
In this session, participants will gain an understanding of what psychological health and safety in the workplace is and some unique considerations in pharmacy practice. We'll review the ecological changes required to create psychologically safe environments. We'll introduce the psychologically safe leader assessment. You'll also gain awareness around the National Standard of Canada for psychological health and safety in the workplace and gain tips on assessing your workplace. We'll close out with some best practices on change management and planning to move you forward in your pharmacies.
Part of the challenge with making progress towards a psychologically safe environment in pharmacy practice is that there's so much information. And pharmacists and pharmacy teams don't have a lot of time to flip through thousands of pages of information, digest, plan, and implement. And we all know too much information can be as debilitating as too little information. Right off the hop, I want to say that it's critical that the steps you make and the effort you put in is not perceived as and is actually not tokenistic. This means saying you're committed to psychologically safe work environments while not actually putting in the work to establish such an environment can be seen as tokenistic. It's not about appearing to be a safe environment. It's about actually being a safe environment. If your organization is truly committed to increasing and focusing on psychological health and safety, you can also check for more information through the Mental Health Commission of Canada. The generally accepted definition of psychologically healthy and safe workplaces is one that promotes positive culture and staff well-being, prevents stigma and discrimination, and contributes to a positive working environment. And we want to do this simply because taking care of our people is the right thing to do. But there are other added benefits too, such as improved morale, improved staff and patient satisfaction, reduced costs, and reduced errors. Adam Grant says, without psychological safety, people hide mistakes and withhold ideas. They aim to prove themselves and protect their image. With psychological safety, people admit errors and voice suggestions, and they strive to improve themselves and protect their team. He also wrote a recent book called Think Again, and he outlines in that book how to know when you have psychological safety in your workplace and how to know if you don't. So some points around when you have it. So you see mistakes as opportunities to learn. You're willing to take risks and fail. Speaking your mind in meetings is comfortable and openly sharing your struggles is possible. You have trust in your teammates and your supervisors, and you're willing to stick your neck out. When you don't have psychological safety in your work environment, you might see mistakes as threats to your career. You may be unwilling to rock the boat. You keep your ideas to yourself. You only tout strengths. And you have some fear of your teammates and supervisors. In fact, many healthcare organizations are even signing on to a declaration of commitment to psychological health and safety in healthcare. Yet when we look through the list of signatories, pharmacy is not represented. We see representation from occupational therapists, dental hygienists, social work, physio, hospital systems, and many more health spaces. Important to note, though, that just because pharmacy is missing on this public list does not mean that there are not any pharmacy practices or organizations that are committed to psychological health and safety, just that they haven't signed the declaration yet. So when we think about psychological health and safety in pharmacy practice specifically, we are thinking about the thoughts and feelings that our workforce has in relation to mental health and psychological well-being. We know this has been especially strained during the last couple of years. To have this type of safety in your pharmacy workplace, it also means there are efforts being put in by leadership, by the team to actively promote well-being and also to actively prevent psychological harm. The key word there is actively. And then there are 15 psychosocial factors that matter and influence the safety of an environment. Our third webinar will explore all 15 of those and how they each relate to pharmacy practice environments specifically. So check that webinar out as well. Next is unique pharmacy practice examples. The first consideration for our pharmacy community is that most community pharmacies work largely on a push basis. This means that our pharmacy teams don't have a ton of control over what their day looks like. While we're increasing this a bit by having more synchronized or scheduled dispensing activities and incorporating some appointment-based services, by and large, we don't know what the day holds when you start your shift. Pharmacy teams can't always control their rate of work. We don't know how many patients you're going to see, when exactly they will come to pick up, or how many walk-ins or waiters or OTC consults you'll have. The nature of this workflow, this push cycle, creates a lot of challenges for pharmacy teams to have predictability and flow throughout their day, and it makes for a really stressful environment. Second is constant distractions. Pharmacists and pharmacy professional work is highly cognitive in nature, yet most community pharmacists are bombarded by distractions while trying to complete this cognitive work. You may be trying to verify dosing at the exact same time that the phone is ringing, the fax machine is wailing, patients are coming in and out saying hello or asking for advice, and maybe throw in a new employee asking you to let them know what this prescription says so they can go enter it. You know, we've gotten so used to working this way, but if you take the normalcy of this out of it, it's a bit wild. You know, think about trying to complete a crossword or a Wordle at home while the phone is ringing, the oven timer is going off, and your child's pulling at your pant leg. It's a challenge for cognitive type of work to be constantly distracted and interrupted. The third consideration for pharmacy is that it's physically demanding. Pharmacy teams are literally run off their feet sometimes. They rarely have a chance to sit down during a shift, and in many community pharmacies, an 8-hour shift is staffed by only one pharmacist, and that pharmacist may often go entire shifts without a chance to eat. For many years, we saw community pharmacists scarf a sandwich down one bite at a time in between patients as the pharmacy didn't close for lunch, and there was no one to cover the counter while the pharmacist took a break. The need for masks during COVID-19 has made this reality even more real. I had a pharmacist tell me the other day they've lost over 20 pounds in the past year because they are too busy to take breaks, and with the mask, they're unable to eat on shift between patients. So they just haven't been eating. The fourth consideration for pharmacy is harassment. We've seen an increase in harassment, even violence, towards pharmacy professionals during the past 24 months. While there were instances where this was present prior to COVID-19, it's increased in recent months. We're seeing verbal harassment related to eligibility criteria, patients' senses of urgency are not aligning with realistic pharmacy practice workflow, vaccine hesitancy, and more. COVID-19 aside, there are not a lot of other professionals who have the same likelihood of being robbed at work, potentially at gunpoint, as well due to the nature of the opioid crisis and the accessibility of narcotics in a community pharmacy environment. Most pharmacists would likely tell you that they wouldn't be surprised if they were robbed during their career as a frontline pharmacist. Pharmacy consideration number 5 is our increasing scope of practice. The pharmacy community has been screaming for an increased scope of practice for many years, and hand in hand with an increased scope of practice comes the need for appropriate compensation. As the scope of practice increases for pharmacists and pharmacy technicians across the country, and compensation is not far behind, we also have to ensure that we have the staffing levels to accommodate these increased workloads. While dispensing technology can help lighten some of the manual tasks, we're not seeing as much innovation in technology that reduces the cognitive workload of pharmacists. And therefore, we need to watch and carefully assess how much we are asking of our professional community. Where is their limit? How can we support them better? Pressure can be motivating, but when pressure becomes stress, individuals may not be able to cope, and that puts our teams and our profession at risk. Pharmacy consideration number 6 is the need for an ecological approach to change. So while we see more and more focus on individuals seeking support, on organizations trying to provide training and support for individuals, such as training on resilience and burnout, we have to remember that making community pharmacy environments sustainable in terms of psychological health and safety We need to ensure we're working at this from all sides. While helping individuals is important in the here and now, we need to be putting equal effort into the primary sources at organizational levels, as well as the social norms at a societal level.
Take this chance to reflect on your pharmacy practice and your pharmacy environment, and think about other unique considerations that impact the psychological health and safety of the spaces that you work in.
Here are a few examples of organizational factors to consider when thinking about an organization's role in creating psychologically safe environments. We need to see reasonable work schedules that allow people to get appropriate amounts of sleep between shifts and nourish their bodies with food throughout the day. Autonomy to practice, at least in part, in professional practice, that pharmacists find engaging, and autonomy in the ways in which the organizational goals are achieved. Role clarity, meaning what exactly are the expectations for a staff pharmacist? What are the expectations for a technician, a pharmacy manager? Team labor and support means we have to be cautious in organizations of the demands that we're placing on teams without the adequate support staff or human resourcing. Everyone has their limits. This leads to the next bullet. What does success look like, right? What does good enough look like? If no matter how well a team does, they're expected to do more with the same resources or less resources period over period or year over year, we have a problem. Lastly is collaboration and consultation. So let's elaborate on this one. Goal setting theory has the strongest base of evidence to drive motivation and performance. More simply put, when your teams are involved in setting the goals and the plans, they're more likely to work towards making those goals and plans come alive. We touch on more factors related to organizations in the webinar on psychosocial factors and pharmacy practice.
Take a moment to consider what other organizational factors you can think of that could help promote psychological health and safety in your pharmacy.
The societal perspective is also important. So this means public awareness of pharmacy professionals' roles and value, governments acknowledging the value of pharmacy professionals, reasonable expectations by the public in line with other health providers, and willingness for interprofessional collaboration by other healthcare providers. So the point is that the work we do to increase psychological health and safety in pharmacy practice must be system-based, and a system consists of individuals, organizations, and society. Providing only solutions at an individual level is a band-aid solution. We need to work on root causes and multi-level holistic solutions as well. Many of you listening are likely in formal leadership positions in your pharmacy or pharmacy organization. For those of you that are not in formal positions of authority, you can remember that anyone can lead, regardless of title or position. A good place to start is within ourselves. Workplace Strategies for Mental Health has developed a free assessment called the Psychologically Safe Leader Assessment. You can see the link here, and it can also be found in our toolkit. I encourage you all to check out this assessment, fill it out, and have a read through the details. It's all anonymous. You fill it out and you get the report downloaded right away. You don't have to share it with anyone if you don't want to. It is, however, a great way to get some personal insight and feedback into your leadership approach in this domain and start getting some developmental tips to move forward as a leader in this space. Here are a few samples of what you'll see in your assessment report. Remember, nobody else will see this, so it's several pages long and it's broken down into different areas of leadership. And so, for example, you'll see how you are self-assessing on communication and collaboration, and we'll compare it to a benchmark sample. And then it elaborates on why this area matters for psychological health and safety and a number of breakdown areas as well. Remember also, this is meant simply as a reflection tool to get you thinking. Take some of it with a grain of salt, as self-assessments in general do not represent the way you would behave or respond in every single situation. It's critical to remember that these tools are acontextual and asituational, so they're not the be-all and end-all of anything. The way we're socialized, the norms in our society are flawed, and they contribute to systemic issues and inequities. Norms are impacted by bias, and sometimes this includes bias we hold against ourselves. And there are also various cultures, and we can't assume that one way is better or more appropriate or right. We also know not everything is within the control of an individual. We can easily question whether an individual has control over all of the leadership traits that they have or not, and the decisions and biases that they hold. So remember, while self-assessments can be flawed, there are also countless people that use these tools, learn from them, and who apply them to their own development solely for the purpose of personal learning. The National Standard of Canada for Psychological Health and Safety in the Workplace, commonly referred to as the National Standard, was established in 2013, and at that time, Canada was the first country in the world to have a standard like this on psychological safety in the workplace. If you're really passionate about this topic, I encourage you to check the whole thing out, but we know you're very busy professionals, barely keeping afloat with your day-to-day, so we're breaking down some of the key pieces for you. We'll pull some highlights from these tools and apply a pharmacy context for you, and we'll elaborate a bit more here and include these pieces also in the accompanying toolkit. So the idea of doing a bit of an audit on your pharmacy is that you need to address some of the gaps before you can start promoting and fixing things, right? You're used to these types of activities in highly regulated environments anyways, so the self-assessment is important to figure out where you have opportunities and then help you create some of the plans to start addressing them. We've adapted some of the audit tools in this space to fit community pharmacy context and included a more comprehensive list in the pharmacy toolkit. Here are some sample questions from the broader list that you can consider when assessing your pharmacy. Our pharmacy has a policy statement outlining its commitment to psychological health and safety. Yes or no? Yes or no to these questions too. Our pharmacy leaders walk the talk and lead by example. Yes or no, the psychological health and safety of our pharmacy team is part of the decision-making criteria when making changes or rolling out new initiatives. Yes or no, pharmacy employees at all levels are encouraged to share perspective and collaborate on plans for a psychologically safe environment. Yes or no, we've built some best practices in our pharmacy worth sharing with others that support the psychological well-being of our team. Yes or no, our pharmacy has worked to identify risks that can harm the psychological health of our pharmacy employees. Yes or no, psychosocial factors have been assessed in our pharmacy. Yes or no, our pharmacy has measurable objectives and targets related to the psychological health and safety of our team. Yes or no, our pharmacy team can make available the resources needed to work towards implementing best practices in psychological health and safety. And lastly, yes or no, our pharmacy has processes to reduce psychological harm of pharmacy teams. In addition to assessing the day-to-day in our pharmacies, we want to think about the life cycle of our employees and the psychological safety at all points. So when new pharmacy team members are recruited, are we ensuring that the hiring process, the interviews, the opportunity for accommodations and engagement are in place? Then when they actually start working in your pharmacy, do we see orientation and onboarding programs that have components around the importance and incorporation of psychological safety and training for competencies around mental health and supporting others? From an evaluation and performance management perspective, we're looking to see whether we're telling others to do things that the leaders don't do, or do the leaders walk the walk? Are we encouraging the employees to come up with solutions? And are we rewarding and celebrating results rather than efforts? Meaning, are they given autonomy to accomplish the tasks in a way that fits their own styles instead of trying to fit everyone into nice little boxes? Next, we know that things are not always going to be perfect. We will have incidents, we will have angry patients, and we will have conflict at work. When this happens, though, do we have systems and supports in our pharmacies to help? And are they effective? Digging a little deeper, do we have progressive policies and systems around accommodation and return to work that are compliant with human rights laws and disability laws? Has your management team been trained on accommodations and accessibility laws? And sometimes we part ways with people too. And when this happens, is this done in a way where people are protected psychologically and supported in the next stage of their journey? And also, do you consider and support those that remain? We know survivors of organizational restructuring can also be impacted. What? So what? Now what? So at this point, you've gained an understanding of why psychological safety is important for pharmacy professionals and pharmacy practices. You've gone through an assessment, come up with a list of opportunity areas to increase the levels of psychological health and safety. Again, you can refer to our toolkit for assessments and help with brainstorming in the pharmacy context. So you get to the point where you have a list of opportunities, and now you get to start thinking about what you're going to do about all of this. What is possible? What isn't? And actually think about meaningful steps towards implementation. So how do you actually start to operationalize this in your pharmacy? We start with change management. If you are in a leadership position in your pharmacy, consider some of the next steps you can take to implement psychological health and safety progress in your space. Assessing your leadership is a great place to start. The next logical step is to assess the change readiness in your pharmacy. We can draw on change management best practices and ask the following leadership readiness questions. Number 1, do I feel confident that I can explain to employees why we need a more psychologically safe pharmacy environment? Number 2, do I believe changes are necessary? Number 3, do I understand how I contribute to implementing changes to create more psychological safety? Number 4, am I feeling positive about the needed changes? Number 5, am I confident that I will be successful in implementing change? And number 6, how credible will I be at this point in time communicating changes to my pharmacy team? It can be harmful to continue to acknowledge the need for change without making plans, without progress, without support. But we want to move forward, and we want to create great spaces for our pharmacy professionals to serve our communities. The key is we want to support you in your actions to move forward and continue to make progress in this space. So here are some key questions when considering if you are ready for change. Number 1, have you established the why? Number 2, can you articulate what is going to change? Number 3, do you have the necessary sponsorship or leadership support? Number 4, have you identified who will be impacted? Number 5, will there be resource impacts? 6, will people need training? 7, have you identified risks, barriers, and enablers? Next, have you, as a pharmacy leader, prepared for leading the change? Next, have you created an effective communication plan? Also, do you have ways to gather feedback and measure success? All of these questions and some further explanations on each are included in the pharmacy toolkit that accompanies this series, and we'll elaborate on some of these planning pieces as we continue throughout this session. Adopting another best practice from change management, we can create a case for change. This will help you define the key messages to help with buy-in and clear communication. People will have questions about what is changing exactly and how it will impact them specifically. So we want to have answers to this. Explaining what we're doing means giving some high-level clarity to the scope of the changes. Keep it simple here. Why are we doing this? This is where you define the reasons for change in about 2 to 5 bullet points. What will change? At a high level, letting people know what will be different. Benefits to the employees. This is where you share what is beneficial to employees about this. They want to know, what's in it for me? Who does this impact? This means who is directly impacted, but also who are your secondary stakeholders, meaning who is indirectly impacted as well. And then when will it happen? Include general timelines on phases so everyone is on the same page with the same expectations. Think about the launch as a project. Incorporate project planning best practices. Now look, one thing I've learned after coaching and helping so many different pharmacy owners implement new systems or projects or work on strengthening culture is that there is not a one-size-fits-all answer. So the next few slides are incorporating key business coaching questions around launching something new to help you define what a successful plan and rollout will look like in your pharmacy. Let's dive in.
We'll cover these 10 key knowledge areas throughout the rest of this session, but also remember that you'll find all this and more in the accompanying toolkit. Integration we'll touch on last because it makes more sense when we structure it that way. But let's go through scope, schedule, cost, quality, resources, communication, risks, procurement, stakeholders, and then sum up with integration.
We kick off by encouraging you to define the scope. That means being really specific about what activities are part of this shift in your pharmacy and define it. What activities are not part of this, and know really what your project is not. Next, we think about schedule. We want to be realistic about timelines. So think through how long will the different activities take you and your pharmacy team? What order do they need to take place in? And also, when will each of the activities start and end? And remember to be realistic because pharmacy professionals are very busy. You want to think about how you will schedule the different tasks based on your availability and how you'll make sure that you know whether or not you're on track.
Take a moment here to record or jot down your key thoughts around scope and schedule for a project like this in your pharmacy.
Next, we think about cost. So what parts of this launch, of this new initiative that you're trying to roll out in your pharmacy, how many of these parts will have a financial cost associated with them? And how can you start to estimate the costs that would be required? Additionally, you need to know what your budget is. Are these funds available? And how can you control the costs throughout the life of this initiative and this culture shift? Next, we're thinking about quality. And this really means, can you be clear around what success would look like here? How will you determine that this effort you're putting in is actually resulting in positive outcomes with your pharmacy team? How can you measure this to help validate it? And what other information can you start to collect to help you know that you're on track and that this work you're doing, this effort you're putting in is meaningful and actually valued in your pharmacy?
Take a chance to reflect here around what costs you might need to consider for this in your pharmacy and what quality or success would look like if you were to implement an initiative like this.
Then we want to think through resources, right? So we want to know who's championing this in your pharmacy. It can be you as an owner, maybe it's a pharmacy manager, it can even be a pharmacy technician, but who's the captain? Who's championing this initiative? And then what other human resources do you have access to help you? How will you take all of these resources and divide up the work that needs to be done? And then how will you manage your time effectively so you can continue to make progress in your pharmacy? Beyond human resources, we want to think about non-human resources too. What are the tools and the templates that are out there that can help you? And you'll find a lot of this information in the toolkit that goes along with these webinars. Additionally, what platforms or programs can you use to assist in staying on task? Communication is so important to make sure that an initiative like this or a culture shift like this is successful. So ask yourself during your planning stages some of these key questions around communication, such as, how will you communicate with your internal pharmacy team around psychological health and safety? How will you communicate with those outside of your immediate pharmacy team? How often will you communicate about it? And how will you monitor and track key communications? And additionally, this is so important, how will you ensure that the communication is collaborative and everyone is heard? So we're not just looking for a top-down info dump.
Take this chance to jot down your key thoughts around communication and resources.
Anytime we're planning to do something new, we do want to be proactive and think a little bit about the things that might not go well. So, what are some of the risks to your work in this space? And how probable is it that those risks might actually happen? And then next, you want to also think about how impactful it would be if those risks happened. And then, if it is very probable or very impactful, we want to think ahead and figure out how do we get ahead of those risks instead of waiting for them to happen. In the same way that all new initiatives have risks, there's often also opportunities. So we want to ask the same questions with a more positive tone. What are all the extra opportunities or benefits that could come out of this effort? And for each of these opportunities, is it probable that it would happen? And would it be impactful if it did? And then if it's probable or impactful or both, then really think through what can you do specifically to actually take advantage of those opportunities as they present.
Take a moment to write down the key risks and opportunities that you've already thought of as we went through the last couple sections.
During your plan, you may decide that there are some goods or services that need to be purchased or sourced in order to make this initiative come to life. You can think about what are those things that you need to source and how will these items impact the cost and the schedule that you had planned? How will you find them? And how will you control them to make sure that you're still staying within budget and, realistic outcomes? Thinking through your stakeholders is probably one of the most important pieces of an initiative like this, right? These initiatives are not successful if they're just somebody writing out some memos or, a top-down approach. We really need to be thinking about this through the perspective of other people as well. So you can ask yourself some questions such as, who are your immediate internal stakeholders? So this would be your pharmacy team and maybe your direct advisors. You also want to be thinking about who are your external stakeholders. So the patients, the community, who are the other, maybe even your peers, who are the other people that could be impacted by this? You can think about who your influential stakeholders are. So this might be connections or influences that you have, different networks that you're part of. You can think about who should be informed but might not contribute. And also, who are your negative stakeholders, right? When we do different types of projects, people aren't always happy about it. So who are the people that could potentially derail this and make it really difficult for you to roll it out successfully? And when you've identified these different types of stakeholders, then we start to ask these questions. How will you, in your pharmacy, engage with all those different stakeholders you identified? And who will be the person that engages with them? And when will they do it? How will you know how these stakeholders are feeling throughout the shift? Be careful not to make assumptions. We want to gather real perspective, right? And then also, to what degree and how exactly will you consider the needs and preferences of the different stakeholders?
Internal and external stakeholders are sometimes easy to identify, but take a couple moments here to think about who your influential stakeholders, informed stakeholders, and negative stakeholders might be.
Integration is where everything starts to come together, right? So you can see questions like, once we have this plan in place, we've thought through these different parts we went over in the last few slides, how will you actually manage the work that's required? Where will you store any of the knowledge or documents or communication? How are you going to control the work? And what happens if someone needs to change the plan? What's the process then? And also, how will you know when your launch is complete? So remember that once you've launched this project, this initiative, you've put a lot of the building blocks and stepping stones in place to move this right into the fabric of your culture. We know that plans, making these plans, are for projects, meaning there's a start and a finish. So you want to look at the actual launch of the Psychological Health and Safety Initiative as a project that you plan. And then once the project is over, it just becomes part of your organizational day-to-day. It becomes lived and breathed in your pharmacy. It doesn't mean that the work is over. We all need to be intentional about putting effort into this space day in and day out, but it's worth it to take care of ourselves and our teams, and beyond that, to drive pharmacy performance and better outcomes for our patients. Here are a few other very important points. We want to make sure that when we're working through this initiative that it's collaborative, okay? Everyone's perspective matters here. You don't have to be an expert to start creating safer, more engaging spaces for your pharmacy team. You can schedule check-ins and milestones and celebrate with your pharmacy team when you reach them. Encourage you to pick a small number of priorities to work through each quarter. These things take time. Be gentle with yourselves. Make sure your efforts, though, are genuine and authentic and not tokenistic. And remember, it's a work in progress. It doesn't need to be perfect on day one. We want to also highlight the things that you do well now, right? And share those best practices with people around you. And when you figure out what's working well now, feed forward, meaning be intentional about doing more of those things. And so the last piece is that we also really want to consider that when things aren't going well, we're making sure that we're focusing our energy on practices and processes and problems, but not on people, okay? Often these are a process or practice problem, and we want to make sure that we keep that in mind as we work through it. We also have to remember that this topic will always be important, and we need to be intentional as leaders to assess it over time and see how we're doing. This could mean going back over your original assessment and comparing your data year over year. It can mean setting new goals and new objectives as you go. So chip away at the opportunities over time and break those opportunities down into bite-sized chunks that you can actually tackle, and then celebrate as you make progress. In the third webinar that follows this one, we explore all the psychosocial factors and pull them into a pharmacy context. Remember, pick a couple of things to focus on first and start making small steps towards a pharmacy environment that is rich in psychological safety practices, engaged workers, and a rich culture that allows your pharmacy to best serve the community while supporting each other.
We recognize that there is often so much information that pharmacy teams may not know where to start. It's also important for us to acknowledge that there are so many unique factors about each and every one of your pharmacy practices. To complement this series on psychological health and safety, we have created a toolkit for pharmacy leaders to use to start to think through the various pieces related to psychological health and safety in their pharmacy practices. We combined Carly's expertise as a physician, psychotherapist, and empowerment coach with my expertise in organizational behavior and leadership coaching to build this toolkit in a way that would allow you and your teams to continue to build a path to a psychologically safe pharmacy environment in a way that best suits your pharmacy and your team. So we built this through the lens of professional coaches to help you be most successful in your work in this space. The toolkit has 3 main sections, one to accompany each of the 3 parts in this video series. Section 1 covers talking to your employees about mental health. Section 2 goes along with this session you are listening to on operationalizing psychological health and safety in your pharmacy practice. And Section 3 covers psychosocial factors and pharmacy practice. Throughout, you'll see summary sheets with quick tips and key takeaways on various pieces of content to help you implement these pieces more seamlessly into your workplace.
Tuck them in a drawer, post them in your flex room, or share them digitally with your pharmacy team, and peek at them when you need some support to get back on track. We have also selected, based on our experience supporting pharmacies, key assessment questions and adapted them for a pharmacy environment so that you can invest your time in value-add activities that will support the well-being of your team in the coming weeks and months. In addition to the coaching lens, we have worked in best practices and tools across organizational leadership, change management, project planning, and goal setting to help you create clarity and confidence in your plans and steps moving forward. If you and your team would like to dig even deeper, we have also included hyperlinks to our favorite resources to help guide you. Thanks for tuning into this section. It's so important that we're talking about psychological health and safety in pharmacy practice, and this is a great first step to help you think about this, reflect on how you can make this realistic in your pharmacy practice, and check out the accompanying toolkit provided with this 3-part series for a lot of tools and templates that can help get you off on the right foot. Thank you also to OPA for sponsoring this session and for your commitment to the professional wellness of the pharmacy community.